I'm going to talk to you about education for our gold probe. We use gold probe with our physicians when we are working on a control of a bleed. The equipment that we will be needing for this is your gold probe and also your Valley Lab. For the gold probe, we have two different sizes. We have a 7 French and a 10 French. Your size can be found on the top right here on the corner. When your physician is requesting that you grab the gold probe for this, put on the call light if you do not have your bleed kit already in your room. We will use a 7 French when we are working with almost all of our scopes except for the 2-channel, and that's when we can use our 10 French. The 10 French is only used when we are going through the 2-channel, and that will be going down channel B. So again, 10 French, 2-channel, channel B. Whenever you are ready for a gold probe, again, put on your call light. While you're putting on the call light, you're going to get your Valley Lab ready. By doing that, we will be putting on the power button. For this, you will not need a grounding pad because you will be using bipolar. For the bipolar, you're going to be using your settings over here. So do not press your recall button because you're not going to be messing with this side over here. So for bipolar, you will be getting out your black cord that is found in all of your drawers, and it plugs in just right underneath that bipolar button, bipolar blue right here. And then you'll also grab out the small foot pedal. You can find your small foot pedal for all of your Valley Labs right underneath where our large foot pedal is. But again, this is bipolar small foot pedal. This is the one that you will hand to your physician. Now your settings are between 10 to 20, so go ahead. I usually start out at about 15 and then verify with your provider of exactly what setting they would like to use. You're going to grab out your gold probe. It can come out just like this. Take off that sheath. And you have a couple of different hookups here. For the hookups that you have, this is the ones that you will be using to hook up to the Valley Lab. So you take the big piece and the black cord and they go right together. This one right here that is right next to the big one is what you can hook to irrigation. So you would take it off of the scope and then you would take and put it up right onto here. So your water irrigation that you put the simethicone in will hook on right here. Verify with your provider prior to doing that because not all providers will want that. For this, you have the gold probe that has the cautery on the end of it, and then you also have the function for an injection needle. For the injection needle, you're going to push it out for the needle come out, pull back to retract it back. When you hand this end to your provider, it needs to be completely retracted prior to handing it to your provider. Otherwise, we will be poking our provider. Epi can be screwed on right to the end so that we can use this for injection. So you just send this right down through the scope. If the provider says needle out, needle out, needle back, needle back. We also can just use it as straight cautery. For that part, when you are doing it, if you see that the mucosa is getting stuck to the end, that's when you might want to ask the provider if they do want to go ahead and hook up to the irrigation so that they can use their foot pedal to kind of put some water down so that you're not getting mucosa stuck to the end of the gold probe and actually making more of a bleed. If anybody has any questions, feel free to either see me or one of the other nurse educators. Thank you very much and have a great day.